school-based health center is a place within a school where a student is able to access a broad array of physical and behavioral health services with the permission of their parent or guardian, so that as issues come up for them, there is a place that they can go. Those centers sometimes provide one-time contacts to students, but for some students, they may provide ongoing care. School-based health centers are extremely important because they provide a real safety net for students who may not otherwise get the needed physical and behavioral health services. They really are designed to ensure that children have quick and access to high quality services. And they also provide an important function in helping families to find services in their communities for continued care that students may need, whether that's for physical health services, maybe for acute or for chronic conditions, and also for needed behavioral health services. So they are really a safety net. They are really an important partner with community providers, whether again, those are medical providers or behavioral health providers. They are a front line really for students to ensure that often early identification of issues that may be presenting, and the work that they do to ensure that children's health needs are met. Because fundamentally, if we're not taking care of children's health, then they are not going to be in the best position to thrive academically, socially, emotionally within their school setting. So they are just an incredibly important part of the health service continuum. The school-based health center strategic plan is really a roadmap for Delaware. It outlines the key elements that are needed to bring a school-based health center on site into a school, to ensure that all of the infrastructure is in place to really position that center to deliver the best care. Looking at things like best practices, issues around the physical space of a school-based health center. And it also focuses on the financing and sustainability of a center. We want to be able to have centers come on board, provide the best care, and to continue to deliver service over the long term. And that plan that's been developed really is a roadmap for how we can expand our school-based health centers here in Delaware. Under the guidance of the Division of Public Health in the Department of Health and Social Services, a large group of stakeholders worked together to create a strategic plan for the expansion of school-based health centers. And that process occurred over many months with both a steering committee, which I had the privilege of co-chairing, as well as a variety of work groups looking at the key areas needed to create this strategic plan roadmap. We worked really hard to get input from everyone across the state. There were interviews and focus groups of healthcare providers in the community, of youth and families served, so that we had the broadest input possible to be able to bring a plan forward and present to help us really take on this challenge of expansion of the school-based wellness centers or health centers across other schools. We're fortunate that we have a number of them, but this was really an effort to look at how we could successfully expand. And fundamentally, we really needed everyone at the table to do that. And so from our interviews and focus groups to our meetings, there was research of national models and best practice around school-based health centers that was reviewed and incorporated. And so each of these elements was really an important part of the puzzle in gathering everything we needed to develop the strategic plan.